Hello everyone! My name is Louisa and I'm a PhD student at the Centre for Cancer Biology within the University of South Australia. I'm also a proud IDFA member and I have lived experience with allergies and asthma. My project focuses on a skin disorder and the lab I work under researches allergy and a little bit of primary immunodeficiency. Today, I'm going to give you an overview of why skin matters in primary immunodeficiency disorders, which I'll refer to as PIDs for short. Before we start, here are a few important things to remember. Inherited genetic disorders are never anyone's fault. If you have a PID yourself, it is not something that you or your family intentionally caused. Your genetic makeup is one of millions of possible combinations that make you unique, and that is something to be celebrated. If you're a parent of a child with a PID, or who I'd affectionately refer to as a PID kid, blame, guilt, or shame are never a part of these conversations about genetics. You have given your child many wonderful qualities, as well as a mix of all of your genes. Sometimes immunodeficiencies can be passed down by pure chance. Again, this is nobody's fault, it's just a part of being human. If this presentation raises any questions or concerns for you, help is always available. GPs, genetic counsellors, secular or religious counsellors, family, friends, and other supports can help you work through the medical, emotional, and even spiritual issues you may be facing as a result of a genetic diagnosis. There are several fantastic organisations that I've included here who you can reach out to for resources, information about research and ongoing clinical trials, community hubs, and other support services. So, let's start with your skin. Your skin is the largest organ of your body and is your body's first line of defense against invaders like germs, viruses, or fungi. Now, there are some germs and viruses that live happily on the skin and don't cause problems. However, when the skin barrier is breached, they can invade deeper layers of your tissue. In a person with an immune system that works properly, this is normally okay because the body's immune cells, like little soldiers, recognize the invader and attack. But in PIDs, there is a problem with how your body deals with these invaders. Your immune cells have a deficiency and for some reason don't work properly. This means that your army of little soldiers has a weaker attack or doesn't recognize invaders at all. This means that germs, viruses, and fungi can cause infections because they can get past your body's defenses more easily than someone who does not have PIDs. Not only that, but you have immune cells that release cool chemicals like antimicrobial peptides, which help to control skin health. Many people with PIDs release less of these chemicals, which also can make the skin barrier weaker. It's for these reasons that skin syndromes provide one of the main clues for PID diagnosis. Having frequent and persistent skin infections mixed with chronically itchy, dry, or scaly skin are all signs that your immune system could be out of balance and that you are likely to have an underlying immune disorder. It's not germs themselves that are the primary issue here. The main takeaway is that if you live with a PID, your immune system is out of balance and cannot keep your skin health in check. So, what do the statistics say about skin disorders and PIDs? Well, up to 80% of people with PIDs have some kind of skin disorder. These can be infectious or non infectious. Skin infections are found between 30 and 69% of people with PIDs and can be caused by bacteria, viruses, or fungi. Bacterial skin infections can appear as abscesses that ooze with pus or as redness and swelling caused by infections in the deeper layers of the skin, which I've shown in the images here. Fungal infections are a bit gross, so I won't include pictures, but they tend to thrive in warm, moist areas of the body and can cause the skin to become scaly, dry, and very itchy. Viruses tend to cause skin lesions such as warts or cold sores and are highly contagious. On the other hand, non contagious disorders of the skin, such as dermatitis, occur in between 13 and 29% of patients, and there are many different types of dermatitis, as I've shown in these images. Common skin issues linked to immunodeficiency include skin infections, viral lesions, eczema, partial albinism, which looks like silvery grey hair, telangiectasia, or spider-like blood vessels, and granulomas, which are clumping of immune cells that can form lumps beneath the skin. Today, I will discuss a couple of PIDs that were mentioned in IDFA's helpful guide on primary immunodeficiencies and the skin. First off, I will discuss immunodysregulation polyendocrinopathy enteropathy X-linked syndrome, also known as IPEX syndrome, which is a genetic disorder that affects 1 in 1.6 million babies born. IPEX is an example of an X-linked disorder, which means that the mother carries the disorder and passes it on to her son, as shown in the diagram. IPEX syndrome is caused by a mutation or an error in the FOXP3 gene. FOXP3 tells your regulatory T cells what job they need to do. Regulatory T cells slow down the immune system by sending out signals to calm down or even switch off overexcited immune cells. They also make sure immune responses finish once the job is done. So there's no unnecessary damage. But in IPEX, the regulatory T cell instruction manual is scrambled, so they can't do their job as effectively. This means that the body can even attack its own healthy cells, including the skin, which can cause skin that's thick and scaly, known as psoriasis, or extremely dry and itchy, known as eczema. Let's discuss another X-linked PID called Wiskott-Aldrich syndrome, also known as WAS. WAS affects 1 in 10 males per million babies born. Eczema within the first month of life, bacterial infections by 3 months, and a low platelet count, known as thrombocytopenia, are the main early warning signs. WAS is caused by a mutation in the WAS gene on the X chromosome. The WAS gene makes an important protein called WASP. Your body needs WASP to make platelets, form blood clots, and to help your immune cells talk to each other. The fancy scientific word for this is forming an immunological synapse. These cells capture and process invaders in your body and make little pieces out of them called antigens. Below is a real picture from a microscope of a B cell showing antigen to a T cell as part of the immunological synapse. How cool is that? When the WAS gene is not working, cells are unable to form the immunological synapse properly and cannot tell each other when the body is under attack. Your body also finds it harder to plug up injured blood vessels because your platelets are smaller and don't work as well. This can lead to skin problems like eczema, small spots on the face, known as petechiae, and lingering bruises or hematomas. Moving on from X-linked disorders, let's talk about HIES, or hyperimmunoglobulin E syndrome, formerly known as Job syndrome. HIES affects fewer than 1 in 1 million individuals. Newborn rash is normally the first sign, which looks like eczema on the face and scalp. HIES can be caused by many different genetic defects, but I will focus on the most common, which are STAT3 loss of function mutations. STAT3 is an important protein which trains your B and T cells and directs other parts of your immune system to help control your body's inflammatory response. In HIES, a person has a loss of function mutation in the STAT3 gene, which means that the STAT3 protein is broken and cannot do its job. One of the cells involved in inflammation are your mast cells. When they are activated by a trigger, they release histamine using a process called degranulation. These histamine granules help your body respond to invaders by allowing other immune cells to leave the blood and to come into the tissues to fight infection. When STAT3 does not work, It means that your mast cells do not have enough energy for this process, which makes it harder for your body to fight infection. This is why skin problems can be hard to manage in HIES because they are often caused by bacterial or fungal infections that the body on its own cannot bring under control. Lastly, I would like to discuss DOC8 deficiency, which can share some clinical features with HIES. DOC8 deficiency is an extremely rare condition. It's thought to affect fewer than one person in a million. Usually, signs appear early in life. However, sometimes diagnosis doesn't happen until later on in childhood or even in adolescence, which can delay treatment. From a young age, children often show eczema and repeated viral skin infections, which can cause warts, such as the plantar wart shown on the foot, or molluscum as shown on the ear and trunk. DOC8 is an important protein for the immune system that helps immune cells survive, move around, and communicate. In healthy people, DOC8 helps these cells respond to infections and supports their movement to sites such as the skin. In DOC8 deficiency, this protein doesn't work correctly, causing major problems for the immune system. Immune cells can't move as easily, don't last as long, and aren't able to communicate or attack invaders, especially in the skin and in other barrier areas. As a result, people with DOC8 deficiency can experience repeated infections, allergies, eczema, and have difficulty with normal immune defenses. Now, I understand that this can be a lot to take in, especially if someone you love or you yourself have experience with some of the PIDs we've discussed today. So, feel free to pause and take a break before we move on to the next section. We've just discussed the many things that can go wrong with the skin in PIDs, but how can you maintain a healthy skin barrier? Well, for starters, it's important to wash hands regularly with non irritating soaps. Some people like to use soap free hand wash to keep more of their natural skin oils and maintain a healthy skin barrier. Changing towels is also a good idea, especially if someone in the house is unwell. Catching coughs or sneezes in a tissue is important too, especially for family members to keep in mind. Staying hydrated is something that's easy to forget, especially when we are busy or tired. Keep a glass out to remind yourself to drink water throughout the day. If you have a PIDS kid, make sure they have a full water bottle to take with them to school each day. This is one step you can take to help them keep up their fluids and better protect their skin barrier function. Moisturizing is also a great way to look after your skin, especially if you've had a flare up. Try to avoid irritants such as fragrances or parabens. It's a good rule of thumb to avoid numbers or big long ingredient names. Simple formulations are always best. If you have severe food allergies like me, watch out for allergens in moisturizers and hand creams such as nut oils, as this could worsen your symptoms. I've come across a lot of good quality Australian made bath oils, ointments, and creams. I had severe eczema when I was younger, and my mum told me she used sorbeline when eczema made my skin dry and calendula ointment when it was cracked and bleeding. While sorbeline can help to control the dry skin that is associated with eczema, it will not control the other symptoms, such as rash, redness, itchiness, and inflammation. Sorbeline can provide a helpful moisturizer to use alongside with a medicated cream, which often contains steroids that are specifically designed to reduce itching and inflammation. Wet wraps can also help with relieving the urge to itch, making it easier to sleep at night. Please speak with your consulting health practitioner for advice on which treatment is best for you or your child. Bathing is also a great way to soothe dry and itchy skin, especially before bed. Non irritating soaps are good, which don't contain additives like the ones we discussed earlier. Some people use Epsom salts or Dead Sea salts to relieve itching, and bleach or vinegar baths to minimize bacteria on the skin. But once again, it is important to consult your health practitioner for advice. Certain salts or chemical additives like bleach might aggravate your symptoms, especially if your skin is broken. You can also refer to reputable websites for eczema bath recipes such as the Royal Children's Hospital Melbourne. After you've had a bath or shower, it's a good idea to moisturize within a few minutes and make sure your body has time to allow to absorb the moisturizer before putting your clothes on. Lastly, oral antihistamines can help with eczema-related itching by blocking histamine. If your eczema doesn't improve with other treatments, you may be prescribed topical calcineurin inhibitors like tacrolimus or pimecrolimus, which reduce inflammation. For severe cases, medications that affect your immune system, which are known as immunosuppressants, such as corticosteroids or cyclosporin, may be used when topical treatments are not effective. Keep in mind that it can take a while to try different things before you find what works for you. This can be discouraging sometimes, so please don't feel you have to do this on your own. Many others with PIDs or allergies have often walked the same path and are happy to share their stories about what has worked for them. Remember to always consult your health practitioner for advice, especially if you're considering medical interventions with corticosteroids or other drugs that can modulate your immune system. Now, as a person who lives with severe allergies, I know that ingredient lists can be really overwhelming. So here are some of the resources that I use to help me cut through the confusion. I use EWG's Skin Deep website as a good starting point to help me make informed choices about what I put on my skin. Skin Deep is a database on thousands of cosmetic ingredients. The team at EWG say they are passionate about protecting human health and that their advice is based on available safety data from toxicity databases and scientific literature. However, it's important to be aware that EWG has received mixed reviews from the scientific community. Some argue that the hazard scores might be misleading because there just isn't enough data on some ingredients to know how truly toxic they are. I do encourage you to go and read these criticisms for yourself. If you're still unsure about ingredient safety, you can chat to your consulting clinical immunologist, allergist, or skin specialist. Another great tool I use is a free app called Yuka. I always keep Yuka handy when I'm going shopping. It's helpful for translating those long, hard to pronounce ingredient names you see on cosmetics, food, and drinks. Yuka uses a simple scoring and color coding system that's easy for me to understand, and you can even upload new products for their team to analyze. Again, some dietitians disagree with their rating system, saying that it's inconsistent and that we shouldn't rely on it to tell us which foods are healthy and unhealthy for us. For me, there are allergens that can cause me to break out in rashes and hives, and ingredients like fragrances in hair products that make it hard for me to breathe. I find Yuka helpful for identifying these ingredients rather than having the final say on what I can and can't eat or put on my skin. It is important to note that I am not a qualified health practitioner or a skin specialist. These are just some of the resources that I have found helpful in my own journey living with allergies. But it's important to do your own research and to speak with your consulting health practitioner. They might be able to suggest other resources which are a better fit for your needs and preferences. Before we finish, I'd like to share with you some exciting developments. Here are some emerging therapies addressing some of the PIDs that we've talked about today. Many patients are now living longer and healthier lives thanks to progress in medical research, and clinical trials are still ongoing to improve and expand access to these treatments. For IPEX syndrome, scientists are testing a new approach called gene therapy, which tries to fix the gene causing the problem. One promising clinical trial happening at Stanford is trying this method with children and young adults. The idea is that they will take healthy CD4 positive T cells from the patients and give them a different job. This new job will be what the patient's faulty regulatory T cells should be doing. The scientists will do this by genetically engineering the patient's own CD4 positive T cells. They will put a good copy of the FOXP3 gene into the cells using a piece of special viral machinery, and will put these cells back into the patient once all the editing is done. A similar approach was also used in a recent clinical trial for WAS. 5 boys successfully received gene therapy and were followed up for an average period of 7 years. Chief and senior investigator of the program, Dr. Sunyoung Pai, said she was thrilled with the results. Her team observed that these boys had improved immune function, disappearance of eczema, fewer infections, and less bleeding. Dr. Pai said that two patients even developed near normal platelet levels, allowing them to play and engage in contact sports. For hyper IgE syndrome, or HIES, doctors now use advanced drugs that block communication networks in cells that cause inflammation. These drugs are called monoclonal antibodies, a type of biologic. Examples of these drugs are dupilumab and omalizumab. Dupilumab blocks a receptor on your cells called the IL-4 receptor that is one of the main players in driving inflammation. Another biologic, omalizumab, soaks up free IgE. IgE, or immunoglobulin E, is a molecule called an antibody which circulates through your blood and tissues and can trigger inflammation. These biologics help to block the immune responses before they can cause problems. For serious cases, a stem cell transplantation can potentially cure the disease, as was recently reported in the Journal of Clinical Immunology. For DOCK8 deficiency, bone marrow transplant is the only known cure, with clinical trials showing good long-term outcomes. In the past 20 years, there have been major advances in success and survival rates in the range of conditions and the upper age limit of patients that can be treated by bone marrow transplant. Bryce Powerman, a man with DOCK8 deficiency, received a bone marrow transplant when he was 19, and he is now a healthy 29-year-old. While waiting for transplants, individuals with DOCK8 deficiency can use biologics to help control skin problems. Exciting research is exploring gene therapy for these cases as well. New research into gene editing technologies like CRISPR, a type of cut and paste machine used to edit genes, gives hope for easier and safer treatments ahead. In closing, skin problems in PIDs can be a real challenge, but taking practical steps like understanding your triggers, choosing the right skincare products, and staying hydrated can make a real difference. Take time to notice changes in your skin health and don't be afraid to speak up about any concerns. There's so much support and resources out there to tap into. I'd say IDFA coffee clubs are a great place to start. Remember that being proactive with your skincare is an important part of living well with a PID. Once you finish watching this video, have a think about one change you can make to how you care for your skin. Or, if you haven't had the chance to put together a skin health routine, I hope that some of the tips I've shared with you here can help you get started. Lastly, I'd like to thank Danae and the IDFA team for the opportunity to put together this presentation. Stay curious, and thanks for watching.